New Year's resolutions can be fun to make and even therapeutic. On this week's Health Talk, we'll discuss how to set realistic weight goals and redefine what it means to live a healthier life in the new year. Stay tuned. Health Talk is up next. Hello, I'm Dr. Chris Larock, Chief Physician Executive here at Nuvance Health. On this week's Health Talk, we're going to discuss how you can manage your weight heading into the new year. Our guest today is Dr. Binetti, a bariatric surgeon with Nuvance Health at Northern Dutchess Hospital. It's great to have you on the show, Brian.
Thanks, Chris. Happy to be here.
You know, Brian, at this time of the year, a lot of folks make New Year's resolutions. And one of the most popular ones to make is managing their weight differently than they did in 2021. What are some of the things that people can do to help manage their weight?
So I think, they could just take a different approach rather than get into a diet, a fad diet, something that is quick and easy. They kind of want to change their mindset. So, approach to their food choices, how they prepare their foods, how they consume their foods, all these things can go a long way. So little changes can add up to a big difference over time, rather than trying to make a big difference, getting into a diet that is maybe difficult and not having the success they want, and then leaving that diet behind very quickly and kind of falling back into bad habits or old habits.
Weight is notoriously challenging to lose, and many folks have success in losing weight, but they find that those habits creep back. So one of the concepts that you're talking about is kind of reframing your relationship with exercise and food. Can you talk about both of those things?
Sure. I think that, we tend to have a lot of information coming at us. So people talk about keto diet and intermittent fasting. You're always hearing these things that you hear that they may work, or you're not exactly sure how to do them. And I think a lot of times it's easier to simplify and just say, hey, I'm going to choose a healthy, whole foods based diet to go by. I know it's going to take time. I know it's going to be hard work, but in the long run, it's going to pay off. So what we like to recommend in our program is a fiber-based diet. We shoot for a higher amount of fiber probably than a lot of other maybe programs. But we find that if you focus in on fiber, things like fruits, vegetables, beans, lentils, healthy whole foods, it's a lot easier to not have to worry about carbs and not have to worry about calories and not have to worry about protein. Just kind of focus in on one number, make good choices, and it seems to pay off. I think in terms of what you're saying about activity and exercise, I think you just want to start small, right? So I always tell my patients, 1 minute of exercise is better than 0, right? So you start with 1 minute and you kind of build up from there. A lot of people don't have the time to come home and work out for an hour or go to the gym and work out. And, that kind of just leads to this frustration where you feel like, all right, I want to do this thing, but I don't have time to do this thing. And it kind of sets you up to feel bad about yourself. So just small little steps sometimes add up to a lot of big difference.
I suspect all that good advice that you just provided us really resonates with our audience. Certainly folks who've tried to deal with weight issues or to get in a healthier lifestyle. You mentioned earlier about your team at Northern Dutchess in the bariatric program. You're a surgeon. Mm-hmm. You do bariatric surgery, which is weight loss surgery. But is that the only thing that happens if I were to come to see you as a patient? Is surgery the only thing that is being offered to me? No.
And I think our goal was to create a comprehensive program where people didn't have to feel like surgery. They were committed to surgery by coming to us. So I always tell my patients, again, we're going to try to look at all the different aspects of weight loss and health. We want to build up a strong dietary foundation. So again, food choices, approach to preparing foods, approach to eating foods. We have options such as metabolic and medication choices where, we can counsel patients, look at their specific individual medical history and maybe recommend some medications they can take to help them lose weight. and then we have surgical options as well. But I don't think you could have one without the other. So I think a lot of our patients, they start in the surgical program and maybe they decide, well, I'm gonna stay more with the non-surgical aspects of the program, and I'm doing good. I wanna keep going with this. Or maybe they start non-surgically because they're a little bit worried about what surgery means and what happens with surgery. So then eventually maybe they come over to the surgery side and say, you know what, I understand more now. I'm ready. Let's go through the surgical process in the program.
Dr. Binetti, there's so much information out there for consumers who are focused on weight loss, and quite frankly, a lot of it seems to come from organizations or individuals that are not based in science, not based in medicine, and have a significant profit motive. Is it only possible to lose weight by working with a physician? What do you recommend to that person who's really stuck and looking for an opportunity to get unstuck?
Yeah, I mean, I don't think you only have to work with a physician, but I do think that, let's just take the regular primary care doctor that you see on a regular basis. They probably don't have a lot of time to counsel their patients on weight loss. They may say, you need to lose weight. They may say, hey, you should do X to help you try to lose weight, but they don't have the time necessarily always to spend with their patients on that. And it takes time and it takes effort. And I would just say that, throughout the Nuvance system, we have different programs where we have the resources and we have the time to spend with patients. So I do think it helps when you're educated and you can make choices that are based on science that will work and will benefit your health and your weight.
So let's unpack that a little bit more. Here at Nuvance Health, we have a variety of experts, both physician and non-physician, who use science and data to help patients effectively lose weight and sustain that weight loss. Can you go through with some detail some of the members of your team who are not the surgeons that would be helping patients if they come to see your program?
Sure. So in our program specifically, we have a dietitian as well as a nurse practitioner who runs what we call our obesity medicine or our non-surgical weight loss program. Throughout the system, we also have a physician lead who runs the obesity medicine program or the non-surgical weight loss aspects of our program. But essentially, it all kind of falls under one big roof in that there are a lot of people who want to address their weight and they want to lose weight and they want to get healthy. And there's a lot of different ways to do it. There's diet and exercise, there's medication, and there's surgery. So, we kind of, as a program and as a system, we've kind of looked at this and said, hey, how can we reach the most people? How can we help the most people? And we've kind of put all these team members in place to do that.
Well, that sounds like an awful lot of resources, but it also sounds kind of complex for a patient to navigate. Can you help our audience understand how a patient might navigate through that complex system of care?
Sure. So all of these programs, have coordinators. So the very first day you come to our program, whether it's surgical or non-surgical, you sit down with a coordinator who goes through the whole process. What options are available, what the program's about, who the different providers are in the program, and just trying to give someone clarity as to what it's about. And then that same coordinator works with a patient navigator, and those people are available throughout their weight loss journey. So they can always have someone to touch base with and ask questions to. We also have different app-based programs for the phone and computer where patients can actually track their calorie intake, track their diets, discuss things with our nurses and our coordinator, and just track their progress through the programs.
That's, again, an incredible amount of resources, and I'm really impressed that each individual patient is treated, number one, like an individual with a bespoke program that's designed just for them, and then they're assigned a navigator to help them through this challenging program. So that's terrific. So at the end of the day, as excited as you are about all of these non-surgical approaches to weight loss, you're a surgeon and you spend much of your week in the operating room doing technically very challenging surgery that you're highly trained to do, and you're getting terrific outcomes, I would mention. Could you just describe an example of a patient who would come to you who might wind up having surgery, what their journey would look like?
Yeah, so again, I want to kind of dispel that myth that this is the easy way out, because a lot of times, people view weight loss surgery as some kind of quick fix or almost a cosmetic thing. But in reality, it's a really tough road, and it takes a while, and it takes a lot of effort and commitment. So there are things a patient has to do for their insurance company, and those things are, generally speaking, pretty similar throughout all the different insurance companies, and we kind of go through that process and that list. Then there are things where we're saying, well, we want to make sure that when we do these surgeries, it's going to be as safe as possible. So there are medical problems that could be risk factors for complications after surgery, and we want to make sure that we've addressed all those medical problems first to make that surgery as safe as possible, because we do have the luxury of time to make that happen. And then lastly, I think the most important piece is all of that stuff that goes into the non-surgical as well. So we really want to make sure that the patients understand what works for them. And I always tell patients, we're going to come at you with different, we're going to come at you with different types of foods that you should be having and different approaches. But ultimately, at the end of the day, it's going to come down to what works for you and what your schedule is like and what your home life is like and all these things. So you have to do some experimentation on your own to try to figure out, what it's going to take. We try to break it down into what we call weekly changes. So, we just pick kind of bigger, let's say, potential problems for their weight and for their health, and we just set them up on a weekly basis to make little changes. But ultimately, I don't think you could have surgery unless you're mentally, emotionally, and physically ready. So I think all of that process gets thrown together, and thankfully, like we talked about, we have coordinators and navigators that help people through that. But it takes effort, it takes time, and I think the average amount of time to get to surgery is probably roughly about 5 to 6 months sometimes.
So a lot of preparation. It sounds like your program and your team really treats the whole patient. They don't just treat the obesity as a disease that needs to be fixed. So given that, after a patient has surgery with you, what can they expect in terms of follow-up with you and the team and in terms of weight loss?
So in terms of the follow-up, I always like to tell patients it's a lifetime follow-up. So, just get used to the fact that you're going to come here for the rest of your life. I think that, to be successful in the long term, because if we look at these surgeries, they work really well. The surgeries are going to work, they're going to lose weight, they're going to feel better. But the human body is a pretty fascinating thing, and it's going to try to figure out what we did and make it so a patient can gain weight again if they're not doing the right things. So I always tell patients that they're going to need us to lean on over the years. And so it's a lifetime follow-up, but in the first 2 years, that's probably when it's the most intense. We're seeing patients probably every 2 weeks at first, and then every 3 months, and then it kind of gets a little bit longer each time. And then we kind of make a determination at that point how frequently patients need to see us. Are they someone who's maybe struggling a little bit, they need to see us continually every 3 months to get back on track, or are they good to go and they could see us on a yearly basis? Because there is blood work involved and follow-up and stuff like that.
Well, it sounds like it's really developing a relationship with the surgeon as well as their team, and it's a partnership for health. And we're very pleased and fortunate to have you within Nuvance Health to offer that service to our patients who need weight management services. But unfortunately, that's all the time we have for today. So thank you, Dr. Binetti, for joining us, and thank you to the audience for watching. Please share your comments and questions with us by emailing us at healthtalk@nuvancehealth.org. We'd really love to hear from you. See you next time on Health Talk.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. Coming back. Ask your doctor, check your blood pressure.
Type 2 diabetes can have a big impact on your life, but how can it be prevented? Well, the first step is knowing if you have prediabetes, a serious medical condition that puts you at high risk for type 2 diabetes. 1 in 3 American adults has prediabetes, but more than 80% don't know they have it. The good news is, prediabetes can be reversed, and for many people, healthy changes in their daily routine can make a big difference. Take the 1-minute risk test today at doihaveprediabetes.org.
Weight loss is a personal journey with many opportunities to improve your health. On this week's Health Talk, we'll discuss various procedures and non-surgical strategies to help you lose weight and to maintain healthy habits. Stay tuned. Health Talk is up next. I'm Dr. Christopher Larock, Chief Physician Executive here at Nuvance Health. On this week's Health Talk, we're going to discuss surgical and non-surgical weight loss options available to patients and to someone who should consider surgery. Our guest is Dr. Brian Binetti, a bariatric surgeon with Nuvance Health at Northern Dutchess Hospital. It's great to have you on the show, Brian.
Great. I'm happy to be here.
You're a surgeon, but you are part of a team that cares for patients who are seeking sustained weight loss. Can you talk a little bit about non-surgical approaches to weight loss, including diet, exercise, and even medications?
Sure. So yes, we have a comprehensive team in place where, we start with our dietitians. So they're the ones who are kind of guiding you on food choices and a healthier approach to eating. They also counsel our patients on preparing food and measuring their foods out, learning to recognize food labels and understand them. And they also help patients with tracking their dietary intake as well. And then we have providers both, in our program and throughout the system who take a metabolic approach to, let's say, non-surgical weight loss. So things like medications. And there are a number of medications out there now that are approved for weight loss. They kind of come in 3 different categories. So one category of medication prevents them from absorbing all the food they're taking in. Another category prevents them from, let's say, having cravings. So they may feel that they have an excessive appetite. And so these medications can help, control appetite and help with food cravings. And then lastly, there are medications that mimic certain hormones in our body that help to address weight on a metabolic front. I think, when we look at someone's weight, a lot of times at a baseline, it's a little bit outside of their control, meaning their brain sets their weight for them almost like a thermostat. And much like a thermostat, your brain has an auto feature. So you lose a little weight, but your body kind of then naturally goes back to that thermostat setting. And so, that setting is set for them by their genetics, by their environment. Certain medications can impact that, sleep, stress, all these things that, again, are a lot of times outside the patient's control. So some of these medications are designed to kind of, address that thermostat setting and help to lower it. And that's really why the surgeries are successful as well, because they are working on a hormonal level to actually affect the brain to lower that setting for their weight.
Well, it sounds like, Dr. Binetti, there's an awful lot to know and to learn about weight loss in order to be successful. By the time a patient gets to you, very often they've tried several diets, successfully or unsuccessfully. They've tried various supplements, various exercise programs, because there's just so much information out there in the weight loss community. Not all of it is evidence-based. Not all of it is bad either. Should patients feel comfortable bringing their histories to you about what they've tried? And if they come to you, are they going to be required to be on a one diet that you prescribe for them, or is there some flexibility built into the choices?
Yeah, I mean, I think definitely it's worth knowing their history, their dietary history. And I think very commonly what tends to happen is they go on some kind of over-restrictive diet. They really cut their calories back. They do lose some weight. But what they end up doing is bottoming out their metabolism. And then they start to eat, let's say, more normally, not even excessively, but slowly that weight creeps back. And then before you know it, they're either at or above where they started that diet. So that, that's helpful to us. And I think that in terms of the diet we are going to, let's say, prescribe, again, I think we try to take an approach where everyone's an individual. We have a philosophy, we have recommendations, but ultimately at the end of the day, a patient needs to find their own way to find out what works for them. So, there may be something that works for one person that doesn't work for another. And we're learning a lot, even genetically, about that, right? So there are people who really respond well to low-carb diets, and there are people who really respond well to low-fat diets. And the two maybe have differences in terms of, the low-fat diet responder may not respond to the low-carb, and they may actually gain weight. So, there's a lot to learn out there. There's a lot to know out there. But again, it's not a one diet meets all.
Again, by the time folks get to you, very often they've been on that roller coaster, and quite frankly, it can be demoralizing for people.
Definitely.
Because they think they're doing the right thing, and yet they're not getting the results, even if they're very, very disciplined. Does your program address the fact that people emotionally are often in a fragile state when they come to you?
Oh, definitely. So, I think the emotional piece is a big component. As a part of the program, we usually have them meet a psychological provider to discuss if there are some underlying, let's say, issues that can be or need to be worked out to help them be successful. And then we put them in touch with other patients who are, there for the journey. So we have support groups where patients can meet other patients who maybe are starting out in the program, or maybe patients who have been farther down the road of the program. And we just, we kind of get into the day-to-day, the challenges, the struggles. And then we usually try to invite, let's say, a third party in that is maybe a dietitian, a social worker, someone who can help shed some light on a specific topic, just to kind of keep it fresh.
Sure. Well, it sounds like all of these non-surgical approaches, which very often have a big educational and counseling and support aspect to them, are important to every patient, regardless of if they have surgery or not. Quite frankly, it sounds like they'd be important to all of us who are trying to live a healthy lifestyle. But ultimately, there is going to be a program that is right for that individual patient. And sometimes that means surgery, and sometimes that means following more of a metabolic pathway. Can you describe a little bit about some of the key decision points and perhaps some of the clinical features of someone who's going to more likely to need surgery versus more likely to follow a metabolic or a medical approach to weight loss?
Yeah, definitely. So, I think that anytime a patient comes to our program, it usually starts with a body mass index. So a body mass index is calculated by, it's kind of a ratio of your height or your weight to your height. And that gives us a certain number. So we define obesity based on a body mass index of 30 or higher. So that's usually the people who start out in our program. And that, that can mean, like we talked about diet, it could mean medication. But ultimately, we're trying to help them get back down to a body mass index that's below 30. As they start to increase their body mass index, they there are risk factors for other diseases that are associated with their weight, such as diabetes or hypertension or joint disease. And those are the patients who I think, start to, have a decision to make where is diet and exercise and maybe medication enough? Am I making progress? Am I getting where I need to be? Or, is surgery an option for me? And is surgery something I want to entertain? And I think ultimately at the end of the day, what I tell patients is, when you come to us, we just want to help you get to where you want to be, right? Our goal is to help you get healthy. Our goal is to help you get away from doctors and off medications and live the life you want to live, right? So I don't think there's any one specific, let's say, patient characteristics that would go to surgery or non-surgery, but I do think you have to be ready mentally, physically, emotionally to do that.
What do you say to the patient who comes to you and says, "Doc, I've tried everything. I know everything. I just can't lose weight. I want surgery and I want it next week"?
So again, I think those patients may be the ones who want to choose surgery, and that's totally fine. But just because they want something quickly, it doesn't mean they can get something quickly. I think that a lot of times we can help them to maybe learn things that they didn't know. We can help them to lose weight on their own, even without surgery. And then, ultimately they have to understand what the surgery is about. And there are different surgeries we do. We don't want anyone rushing into surgery. And again, surgery is not a quick fix. It's a lifelong process. So we want to, be able to address that patient, with education and knowledge.
What can a patient who ultimately does wind up making the decision to have surgery with your counsel, what can they expect in terms of rate of weight loss, how they should feel after surgery, what type of complications they could have, and what type of follow-up they can anticipate having with you?
Yeah, so I think that the results are, statistically very good. Every person is a little bit different as to how much they'll lose. We tend to grade our weight loss based on ideal weight. So ideal weight is this concept where essentially no one is their ideal weight. It's based on your height. And it's probably was created in the Great Depression era or earlier. I'm not sure exactly when it was created, but patients can expect to lose weight loss based on their ideal weight. So the amount of weight that they are above their ideal weight, these surgeries, they'll tend to lose anywhere from about 55 to 65% of their excess weight above that ideal weight. I think the follow-up is quite rigorous after surgery. So, at first we're seeing them on a weekly basis, and that's because of their diet advancement. So they have to learn the new dimensions of their stomach. They have to kind of almost learn their approach to food all over again. And we kind of hold their hand as they're going through that process. So they start at liquids and they move to a puree, into a mushy, back to a regular type of diet. And then there are, dietary supplements we want them to have because they're not eating a lot of food just yet and that diet is not yet balanced. We're going to want to make sure they're on the right vitamins and minerals and micronutrients so they're getting what they need. And then we're going to test all of that along the way. So periodically after surgery, patients are getting tested for their vitamin levels and their mineral levels with blood work along the way.
Well, I think in summary, it sounds like if a patient were to become part of your program, they really are having a team approach, and that is a partner in their health. And that partner is going to individualize the care for the individual needs of that patient, and they're going to stick with them potentially for life. And that sounds like a really attractive option for folks who very often are frustrated with the challenges associated with weight loss. But unfortunately, we're out of time, Dr. Binetti. I want to thank you so much for joining us today, and I want to thank you, the audience, for watching. Please share your comments and questions with us by emailing us at healthtalk@nuvancehealth.org. We'd really love to hear from you. We'll see you next time on Health Talk.